You mentioned this in your talk that you were able to give to us about the different phenotypes. Can you talk a little bit more about the patient presenting with, certain conditions? And so neurologists, I guess, would probably be familiar. They would be the ones this question can be helpful for.
Exactly. So, as I said earlier, the paraneoplastic syndromes can affect any part of the nervous system. The brain, the cerebellum, the spinal cord, and even in the brain, for example, the brain stem or the basal ganglia can be main targets. And of course, the nerve roots, the nerves themselves. So essentially every part of the nervous system. So depending on which part is mostly affected, patients will have different symptoms. So for example, in cases of encephalitis, patients often develop a subacute, meaning within weeks to months, changes in their cognition, changes in their behavior. Seizures are very common, sometimes visual or auditory hallucinations. Often seizures tend to be quite refractory to anti-seizure medications. If the basal ganglia, which is part of the brain that controls movement and origination of movement, are affected, patients can present with Parkinson-like symptoms, difficulties with walking, tremors, and abnormal movements. And if the cerebellum is the main target, then speech dysfunction, difficulties with ambulation, coordination, and balance. If the spinal cord is the main target, often patients will have difficulties with walking, trouble controlling the bladder, or having sensory changes, losing the ability to sense. If the peripheral nervous system is the main target, sometimes patients can have painful neuropathies or nerve pain, and also losing or lack of feeling that leads to significant trouble with balance.